I've been personally quite shocked to see how ubiquitous trauma is in developed countries, in cities that one would consider progressive. It's ubiquitous, and although you don't always need trauma to have dissociative responses, it's a common relationship, and dissociation is a defense mechanism to trauma, but as well to other things. So let's go into dissociation, define it, describe the different types of dissociation, dissociative disorders, talk about what is normal and what is abnormal, because we all normally dissociate. That's okay. But also kind of trying to see when is it not helpful and what we can do about it. But before we begin, a quick disclaimer. These videos are made in my personal capacity. I'm not representing a medical college or workplace. This is not medical advice. This is general information only, and it does not replace you getting your own medical attention from a medical professional. Now, dissociation. Dissociation is an experience that we've all had to some extent normally. You've been in the car, you've gone for a drive, and then you've realized that maybe 5 minutes has passed and you've been driving, you've navigated the traffic lights or whatever, and then you don't remember any of it. You've just traveled in time, basically. Daydreaming, it's a form of dissociation. But if we want to just describe it in simple terms, dissociation can be considered the mind's way of disconnecting to the body's experience. And when you describe it in those kind of simple terms, you realize how, yes, it can be helpful, but also how it can be unhelpful. How can it be helpful? When is it normal? Well, it's normal, as we've described already, in certain times when you're inattentive or, brushing your teeth or thinking about something else and you've disconnected to your normal reality, you've dissociated a little bit, but then you can come right back into your body and you can do it consciously. You can choose almost. But it's also helpful if you're experiencing significant trauma. Now, some people theorize that the evolutionary basis of the mechanism of dissociation is from when we're experiencing significant physical trauma. Like if a tiger is eating at your throat and you're dying, you don't want to be embodied. You don't want to be in your body when that's happening. You want to dissociate, and that's supported by all the descriptions of or near-death experiences where people describe this kind of dissociation where they look at their body from a top-down perspective whilst the body where they were is experiencing some form of significant physical trauma or like, for example, a drowning. Now, people in different cultures will have different justifications for this experience. There are religious explanations where people will describe that as transitioning to the afterlife, or it's influenced based on the cultural kind of medium that it's happening in. But from a kind of biochemical scientific perspective, we call that dissociation, and it's a result of biochemical changes in the brain and different brain structures that we'll talk about in a second. But when does it become unhelpful? So we've described when it's helpful. It's helpful when the body's undergoing trauma. And another group of people that have a lot of dissociation are people who had childhood trauma. So in childhood trauma, when you're experiencing a trauma, you have a fight or flight response, right? Your amygdala fires. It's a part of the brain that triggers the rest of your body to release adrenaline and move blood flow into your limbs, and get your heart racing and gets you really ready for a fight or to run away. But when you're a child or when you're helpless, you can't run and you can't fight. So what do? Well, you escape. Like, you can't escape physically, so you escape mentally, you escape within, you dissociate. So it's a common defense mechanism seen in people who have had childhood trauma, and it's very helpful when the person is enduring trauma during that phase. Unfortunately, afterwards, once trauma has stopped, and the psychological mechanism of dissociation can linger and can continue, and it can be against one's will, and it can cause problems, right? So if you're in an intimate relationship and you can't focus on what your partner's saying, or you have a family member who's sick and you can't connect or mourn or feel emotion because you've numbed it, because you've dissociated from it, I should say that dissociation can also often be talked about as emotional numbing, and they're pretty closely related, those two phenomena. All these unconscious dissociative experiences can cause problems, can cause functional impairment, can cause problems in relationships, problems at work, problems in living the life that's worth living. So that's when it is pathological, when it's a problem. So it's important to remember that a lot of problematic psychological mechanisms like dissociation occurred when they weren't problematic, when they were adaptive, when they were helpful, right? They started off as helpful. When you're a child, or when one is a child experiencing trauma, dissociation is a very helpful mechanism, and later on it becomes unhelpful. And so it's almost like you have to detrain the brain from something that was almost life-saving. Now, obviously, ideally, we don't want any trauma in childhood, right? That's the core issue here that we should really put a lot of resources into addressing, into reducing childhood trauma. Absolutely. But in reality, there's a lot of people who have been exposed to childhood trauma, and we don't have to go through examples. You know what I mean. And dissociation is a very common thing in society, so we have to deal with it. And so that's why I'm making this video. So when I think about dissociation and the way that it presents in different kind of categories, there's the kind of perceptual way that dissociation can affect you. So that's depersonalization and derealization. Then there's an identity way that dissociation can affect you. That's something called dissociative identity disorder. And then there's the effect on memory, where dissociation can affect literally how you remember things. And that can be called dissociative amnesia. And then I'll talk about other things I've seen, other ways that dissociation can affect people. So the depersonalization, derealization, perceptual experiences. So depersonalization, that's the experience of not being in your body, right? It's watching yourself, looking at yourself in the mirror and seeing someone different. It's you look at your hands and they feel very far away. It can be quite distressing, and it's different to derealization, which is really when you're looking around and you feel the world around you is fake. And some people describe letting like they're in a TV show, like The Truman Show, that movie with Jim Carrey. So those are kind of two ways, and often they coexist, right? A lot of people will have both those things. Now, the way that it can affect memory, dissociative amnesia, that can be like in fugue states where people don't know who they are, but they're moving around. They look like they're completely disconnected from reality. They might not recognize people they used to know. And often they'll travel. People in fugue states have traveled across different suburbs or cities even. So dissociation can not only affect your relationship with your body, with the reality around you and the environment around you, but also to your memory and your past. And then the third area I wanted to explore of dissociative identity disorder is really when there's such profound splits in the development of one's identity that they can dissociate completely from one another. And that's often, it's a pretty rare syndrome and controversial syndrome. Apparently, there's like debate around it, but essentially, from what I've seen, it's often in people who've had childhood abuse from caregivers. And you can imagine as a child when you idealize your caregiver, right? You remember we all idealized our parents at one point, where we think when we're little and we think all our parents are perfect and things. When the person you think is perfect is acting imperfectly, let's just say, it's easier to split yourself into two different kind of personalities, basically. The one that's dealing with the imperfect parent enduring abuse, and the one that can relate to the parent normally. So you usually form splits, and people who are they can be disintegrated, literally disintegrated, not that they have separate selves. Now, dissociation can also do other things, right? So someone can become so dissociated that they have trouble in reality testing and can look psychotic. And whether that is psychosis or not psychosis is an academic debate. But I've seen people with extreme anxiety and post-trauma and dissociative responses and they have these brief reactive psychoses that last less than a day, or less than 2 to 3 days, let's say, and they respond very quickly to treatment, like supporting sleep and medicines if necessary. It's important to also acknowledge how functional neurological disorders can involve a strong aspect of dissociation. So seizures, which can be epileptic or I guess non-epileptic. I say I guess because it's changed names a couple of times. This class of seizure that is not because of neuronal abnormal, involuntary, sporadic, unregulated firing, which is what's happening in a classical epileptic seizure. But it's happening more as a result of a dissociative response with a severe limbic excitation overwhelming the rest of the brain and creating what's known as either a dissociative seizure or a functional seizure. It used to be called pseudo-seizure or non-epileptic seizure. Those names have kind of gone out of fashion. I guess people didn't feel they were very validating terms. But I like to think of them as a functional dissociative seizure, and I like to think of it as a kind of limbic response that overwhelms the rest of the brain. And it has a different kind of treatment profile to epilepsy, so that's why it's important to make the distinction. But an important thing to remember with that situation is that many people can have both, right? So people with epilepsy who have epileptic seizures can also have dissociative functional seizures as well. And the percentage rate is very high, apparently. So always got to keep your eye out that just because you see someone have a dissociative functional seizure doesn't mean that it also have a normal seizure disorder that requires treatment in its own right. So got to do a full assessment. So I hope that gives a good overview of all the ways that dissociation can affect one's experience in terms of the perceptual, the memory, the identity and personality, and as well in terms of seizures and psychosis. So dissociation can really be a thing that presents in multiple ways. In terms of the neurobiology on how dissociation works, so we don't know exactly how dissociation happens at a neurobiological neuronal basis, but we've got a good understanding of the important brain areas, and there's active research going on to try and understand what's inhibiting, what's activating. At the moment, we just know the very key important brain areas. These are things like the prefrontal cortex, which is an important kind of conductor of the brain and can turn off and on different areas. The amygdala and the limbic system, very important in the stress response and emotional responses. The insula, which is a kind of bodily referential kind of a brain structure that can get a sense of your bodily state. And that with the posterior cingulate cortex, they both can connect with the autonomic nervous system as well to kind of get a sense of what your body state is in. So if you're in a fight or flight mode, that can definitely kind of trigger dissociation, right? To avoid the overwhelming, emotional pain, one dissociates. So those parts are very important in regulating or scanning when one is coming overwhelmed. And of course, the hippocampus and other memory centers are important when people are getting kind of fugue states and not forming memories. So in terms of treatment, look, it's tricky because there's no specific pill that we can give that just re-embodies someone, resolves dissociation, removes trauma, and makes everything okay. That kind of stuff doesn't exist. It's usually a complex treatment plan with multimodal interventions. So that's why we always follow the biopsychosocial approach. And that, biologically, you want to address anxiety and trauma responses, and there's lots of medicines available, anti-anxiety medicines and antipsychotics at lower doses, and other medicines as well. But it's so different between different people. I'm hesitant to name specific medications, but I guess a key thing to be aware of is that this is a high-risk area for benzodiazepine use, that they have to, if I'm not saying they should or should not be used, it's complex, but there are risks associated with the long-term use of benzodiazepines. That's a pretty non-controversial statement. So one must be careful and try and look for alternatives if possible, and try and reduce the doses where possible, and try and keep it for a short amount of time as possible, if possible. So that's the spiel on the benzodiazepines. If they've been trained properly, they're not going to bring up all this trauma and then just leave you bare and broken down. They're cautious. They're, hopefully if they've been trained well, they will understand your defense mechanisms and your stresses and work with you at the level that you're at to kind of bring up what you need to bring up. And it's led by you, right? So please do give therapy a try if you haven't. And just because you've had one bad therapist doesn't mean the next one will be. It's one of those things you do have to kind of try multiple out sometimes. And in therapy, you can learn lots of useful techniques to kind of reconnect with your body and be grounded. That term that they use, grounding techniques. I've made a video about a grounding technique, 5-4-3-2-1 grounding technique. I think the name is the video. It's a tool that I use for people who dissociate or feel overwhelmed in front of me and can just reconnect with the world around you and with your own body. So I hope that was a good overview. I just, hope I kind of just wanted to get that out. And if you guys have anything you think that I was right or wrong about, please comment down below. If you have any personal insights, please share them down below. Just be sensitive with what you share. I hope that this was helpful, and I wish you all just a wonderful day. If you found it helpful, please consider liking the video and sharing it with a friend and subscribing to the channel. We're almost at 100,000 subscribers, which is very exciting.